Hey there. If we haven't met, my name is Lisa Mustard, and I'm the person behind the scenes of the Therapy Show with Lisa Mustard, a podcast where I interview seasoned and knowledgeable talk therapists from the counseling world to glean valuable insights, techniques, and tools that you can apply to your practice and your life. Plus, you can also earn continuing education contact hours from some of my episodes. So, to learn more about the show and get your first continuing education contact hour for free, head on over to my site, lisamustard.com.
A little over 15 years ago, when I started my private practice, I had to learn a lot, and most of it the hard way, and I don't think you need to do the same. Hi, I'm Gordon Brewer, a licensed psychotherapist, and welcome to the Practice of Therapy podcast, part of the PsychCraft network of podcasts. Join me in this journey of discovery as we have conversations with other leaders and professionals in both the mental and allied health fields. Join us as we explore both the business and clinical sides of running a private practice. Welcome to this episode of the Practice of Therapy podcast. This is episode number 257, and I'm Gordon Brewer, and glad you're with me. Glad you're joining in, and hope you are doing well. Here as we are getting towards the end of the month of November, and I guess it would be fair to say, as you're listening to this episode, we're full force into the holiday season, and I hope it's going well for you, and you're getting a lot of good and fun times with friends and family and all that sort of thing. I'm really looking forward to you hearing from my guest today, Dr. Omar Reda. And Dr. Reda was a person that reached out to me. He is a psychiatrist and has written a book called The Wounded Healer. And, it's interesting how my episodes tend to follow different themes. And I realized as we were getting this episode together, had a few other previous episodes that are on this topic of self-care and being able to take care of ourselves as providers and as people that are other helping professions. And so I think you're really going to enjoy this episode, or at least find it enlightening in just his perspective of the things that he's noticed, particularly as working since we are coming out of the COVID pandemic and all of the things that has implied just across healthcare in general. And so I'm looking forward to you hearing this conversation. Would love for you to, before we get to my episode with Dr. Reda, I'd love for you to check out the Practice Launch Club. And if you're in those beginning stages or beginning phases of running a private practice, maybe you've already started your practice and getting it up and going, or maybe you're just thinking about starting a practice, I'd love for you to join me in this community, this exclusive membership community. And you can find out more about that by going to practiceoftherapy.com/launch club. And when you go to that page, you'll see information for you to join. And also, if you'd like to just have a conversation to see if this would be a good fit for you, I'd certainly welcome that. But we meet twice a month as in our little cohort of members and talk about our practices and maybe some of the struggles and ups and downs and ways that we can kind of tackle all the different tasks of running a practice on both the business and clinical sides of things. We also have a private community on the Circle platform where we interact with each other and ask questions and talk about the things between our sessions with each other. But anyway, love for you to check it out. You can go to practiceoftherapy.com/launch club to find out more about that. And also, before we get to my conversation here with Dr. Omar Reda, I'd love for you to hear from our sponsor of the podcast, TherapyNotes.
Is your practice running like a well-oiled machine? One of the keys to a successful private practice is having the right systems and processes in place to make things run as smoothly as possible. With a powerful, secure, and streamlined system like TherapyNotes, you'll have more time to spend with what matters most, your clients. TherapyNotes is a complete practice management system with everything you need to manage patient records, schedule appointments, meet with patients remotely, create rich documentation, and bill insurance right at your fingertips. Their streamlined software is accessible wherever and whenever you need it. It's the EHR that Gordon uses in his practice. By using TherapyNotes, your clinical records will be secure with less paperwork, which means you can give a much better quality of care. TherapyNotes integrates all aspects of your practice to help you improve patient care. Be sure and check them out today by going to practiceoftherapy.com/therapynotes. And be sure to use the promo code GORDON to get 2 months free.
Well, hello, everyone, and welcome again to the podcast. And I'm really happy for you to get to know today Dr. Omar Reda. I'm glad you're with me, Omar.
Thank you. It's an absolute pleasure to be with you, Gordon.
Omar, as I start with everyone, why don't you tell folks a little bit more about yourself and how you've landed where you've landed?
Thank you. So, I am a psychiatrist by training, but a humanitarian at heart. So I found myself to be doing lots of trauma work based on my own trauma story, coming from a refugee background and also having family members who died because of the civil war in my home country, Libya. But not only taking care of refugees, I have found that trauma can impact us as individuals, families, and communities. And very, very recently during the pandemic, I have noticed that trauma can also cause dysfunction in the homes of my coworkers. Many of them are leaving the field of medicine or nursing. Many of them are using substance to numb their moral injury. And some of them, unfortunately, have died by suicide. So I wrote The Wounded Healer to bear witness to their stories.
Wow. Yeah. Thanks for sharing that story. Yeah. So what have you learned about all of this so far? Tell us about kind of your process around writing your book, and then, just kind of some of the things that you've landed on about all of this.
Yeah, I have been writing for the Psychiatric Times for a number of years. And during the pandemic, I really wrote extensively about the amount of dysfunction that I have witnessed in the healthcare industry. And it looks like the system has been a really scandalous system and very dysfunctional even before the pandemic. But it has been heavily exposed how toxic the healthcare industry during the pandemic. So unfortunately, I have lost a number of my coworkers for suicide. Others are, coping with their trauma through substance use. Others have decided to leave nursing or medicine. So while the article, it was approached by the publisher, Norton, who told me I need to write a book. And I told them I'm happy to write the book if they wanted a book with a soul, which means I'm going to write the stories of my coworkers. And I was very lucky and privileged to do that. So in The Wounded Healer, you will read many, many stories, and each story will bring a specific theme that I have noticed, a theme that needs to be broken, because this, pandemic is a silent killer. It's affecting many, many people and leading to severe dysfunction, not only on individual level, but I have also seen families that are destroyed by trauma.
Yes. So I'm curious to hear kind of, you talk about the brokenness of the system and just kind of how we landed where we've landed. I think, I think you're exactly right. I think that probably the trauma of the COVID pandemic just brought out a lot of the problems that were happening. And as you've heard people's stories, what what are you seeing as kind of the things that have created this system that is dysfunctional?
Yeah, I mean, I see a spectrum. I see some good news that, there is a blessing in disguise, that some people are actually, appreciating the value of self-care and are asserting their boundaries and taking care of their loved ones. I have seen on the other side that we are still holding very deeply to very dysfunctional beliefs that we have learned from, medical school, nursing school, social work school, therapy school, that we
Mm-hmm.
are invincible, that we need to be everything for everybody all the time, that we should not show any emotions, that if we express our feelings, that's a sign of weakness. And even maybe if we talk to someone and trust our supervisor, maybe our case is going to be reported to human resources and we might lose our license. So all of these beliefs make people continue to suffer in silence. That's
Mm-hmm.
why I hope the wounded healer is one added tool to break the silence and break the cycle.
Right, right. Yeah. So, would you mind sharing maybe some of the stories that you've heard, and just kind of what was kind of the resolution for people, or how have they healed from these different things?
Yeah, I mean, as you will notice, I mean, the Wounded Healer is divided into four chapters. The first one is about our relationship with our clients. So that will bring lots of pain, but also lots of joy, hopefully, if we
Mm-hmm.
know the value of what we do, if we work on our burnout, if we value the contribution that we, provide to the system. So sometimes we tolerate behaviors that are really should not be tolerated, like violence against staff, maybe harassment. All of these things happen to us as a therapist, as people who are healers, and we continue to carry that wound and we don't acknowledge it, we don't nurse it, and we just stuff one more skeleton into our closet, and that will end up, unfortunately, biting us in the back. And so
Mm-hmm.
that's when it comes to the relationship with our clients. The second chapter is our relation with our families, and I have noticed that burnout can lead to a trauma that can break our family unit. So many of us, we take care of our patients and we ignore our families. I spend all of my energy outside home and I come to my loved ones very depleted and I don't even have the energy to play with my children or respect my spouse. Maybe I will take my anger on them, my frustration on the
Mm-hmm.
family unit. And I have noticed many of our loved ones are walking on eggshells around us because we are either lashing out or shutting down in front of them. So that's the second chapter. The third one is the relationship that we have with the systems that can either crush or revive our souls. So, for example, our female co-workers, they go through lots of trauma because of sexual harassment. Some of people of color, they might go through racial trauma. And there is lots of trauma that is embedded in the system. And
Mm-hmm.
some systems that just need to be rehabilitated, but other systems, they deserve to be dismantled. And the last chapter is a relationship with ourselves. And this is maybe the most difficult thing to do, is to
Mm-hmm.
sit down and acknowledge our own needs and take care of our old wounds so they don't get reopened with a new trauma.
Right, right. Yeah, I'm looking forward to jumping into the book. But yeah, as you've worked with people as they work through these to some degree, maybe I don't know if it's fair to say that some of this is kind of secondary trauma to the trauma that they deal with patients. And I would imagine that just kind of compounds things for people. But as you've worked with people as they work through these things, what's kind of the starting place, do you think, for people?
Yeah, thank you. And for acknowledging this is usually cumulative or, compounded trauma. It's not only
Mm-hmm.
one, event that will lead somebody to leave the industry. It's really something that they have tolerated for a long time. It's a toxicity, it's a burnout that's causing dysfunction in their professional and their personal life. So what I do usually is just I try to use a comprehensive approach to wellness and healing. So yes, many of us, we only take care of our biological needs. We focus on our body. We practice sleep hygiene. We eat healthy. We exercise. All of these are wonderful. At the same time, we should not forget, Gordon, that we are not only made of a body, we are made
Mm-hmm.
of, a psyche or a mind. So I need to take care of my psychological needs. We are made of a heart. So I need to take care of my social needs. And we are made of, a soul. So I need to take care of my spiritual needs. So the wounded healer encourages, the wounded healers to take care of themselves in a, very comprehensive way, and also to practice self-care in a community. So I
Mm-hmm.
don't do it in isolation, but also my co-workers will lean on me and I will lean on them. They give me feedback. I will notice them. And together we practice what I call deep kindness. So we really care about one another and we notice the subtle changes in each other and we receive and give feedback. I think that will be a better, community of care, a better workplace to actually work in.
Mm-hmm. Mm-hmm. Yeah, I just have it's funny. What kind of coincidental? I had my took my wife to a doctor's appointment. I've shared on the podcast before that my wife is disabled, and she has several medical concerns and that kind of thing. But
Mm.
also, I had a follow up appointment for myself, and one of the things I noticed when I was going to these appointments is that a lot of the people in the doctor's offices, including the doctors, just there was a sense of being rushed and a
Mm.
sense of urgency to everything. And I realized, in some medical situations there is an urgency, but these were just follow up visits. But and just feeling kind of tied to the processes behind the scenes seem to be more important than the people around them. And that was just an observation I had today.
Yeah, I mean, thank you for noticing that. That's really one of the most, important and the most common things that my coworkers use or share with me when we talk about reasons that they are burned out. Many times it's their moral injury, that's their ethical dilemma. When I spend more time documenting, more time talking to the electronic chart more than the patient, and
Mm-hmm.
really, the unfortunately because of insurance pressures and other issues within the system, that we treat people as check boxes, and the
Yes.
faster I see someone, the faster I make money. And I refuse to do that. I mean, I am a
Mm-hmm.
psychiatrist, but I don't only dispense medications. I try also to prescribe hope and listen to the trauma story and spend time with my patients, even if I miss the bonus at the end of the month. And that's worth it for me.
Yes. Yes. It's yeah, and that's I think that's the thing that I think has to be really acknowledged is that we've particularly as healthcare has gotten really kind of, for lack of a better term, kind of corporatized. I guess I'm making up a word here, but to some degree, where you're right, I think sometimes the profits become more important than the care that is given.
Yeah, I mean, many of my colleagues, they say really the challenges that they face are not clinical. It's very easy to work with the patient. The challenges are usually bureaucratic, working with the system. And
Mm-hmm.
as you mentioned with your wife, I mean, we are not only caregivers when we work with our clients, we are caregivers in many, many other capacities.
Mm-hmm.
And unless I take care of myself and I have some gas left in my tank to spend on my loved ones, I might actually see taking care of them as a dreading and a resentful thing. And I
Mm-hmm.
don't want to resent my loved ones. That's why I need to really take care of me. And I don't see it as selfish. I actually see it as a selfless act. I think
Mm-hmm.
it's not a luxury to practice self-care. It's a responsibility towards my clients, towards my coworkers, and mainly towards my loved ones.
Yes, yes, yeah, I love that, and I think you're right on the mark with that. So Omar, again, what are some of the, I guess, kind of maybe stories of hope that you've been able to encounter or seen in both your research and just in your own life experience, where you've seen things change and become better for people in healthcare and those of us that are caregivers?
I have seen lots of progress, especially in the last 2 years since the beginning of the global pandemic, that many systems are waking up when they are prioritizing the wellness of their staff. They are creating positions for, chief wellness officer. They're building programs that focus on emotional expression and supporting staff, especially frontline staff. So I'm very encouraged with that. And I'm especially encouraged when I see that on an individual level, when staff actually value their own worth, when they prioritize their own self-care, when they verbalize their needs. I have seen lots of that. At the same time, because we are playing catch up, unfortunately, we are seeing many people still leaving the field. So
Mm-hmm.
that's why I'm a big fan of not only intervention programs, not only reactive programs. I'm a big fan of proactive programs that focus on prevention. So not only addressing the back door, but mainly addressing the front door. Why do
Mm-hmm.
people go through burnout to start with?
Yeah. Yeah. Well, what I'm curious, other than people learning to treat each other with more, I guess, as I like to say, kindness and compassion, what are the other things that I guess we can do in the various places that we work and the interactions? What else do you feel like is helpful?
Yeah, I mean, starting with myself, and I want to acknowledge Gordon here. I'm a psychiatrist, so I have extra
Mhm.
privilege of easily speaking up. If I get fired from a position, I can easily find a job. So
Mhm.
I know that I am at a position of a privilege, and not everybody can do that. Some of my coworkers are stuck in very toxic systems because
Mhm.
they have families to feed and they need to take care of the materialistic needs of their loved ones. At the same time, what I have found to be very helpful for me, at least, is speaking up. If I see a dysfunction, if I see injustice, if I see anything that will take away from the beauty of the encounters that I have with my coworkers or my clients or my loved ones, I can easily speak up. I can challenge a policy or a procedure. And mainly, I express my emotions and assert my boundaries. And I encourage everybody to do that as well. So when
Mhm.
I see a coworker, and I have done that on multiple occasions, when, for example, one of my coworkers who is not a physician, her best friend died, and the best friend died in another state and left behind very young children. So my
Mhm.
coworker wanted to take time to go and grieve her best friend, and she was told by administration that she cannot do that because the best friend was not a family member, and you cannot secure time off to grieve, a friend. So I went to leadership and I actually challenged that procedure and that policy, and together we were able to give her a weekend to fly and spend time with the loved ones of her best
Mhm.
friend. And she told me
Mhm.
that was the best thing that happened to her. The best thing
Right.
for her emotional needs at the time is to have somebody at a position of power or privilege who can speak on her behalf.
Right. Right. Yeah, that's a great story. Just about, I think, yeah, and I think, what's interesting. I know here in some previous episodes, I talked with some Jenny. I believe it was Jenny. I don't want to get her last name wrong without looking at it, but her name was Jenny, and she's done some work around vicarious trauma, and I think one of the things that we have to recognize is that with particularly working in the mental health setting and also just a whole different other kind of trauma for people working in hospital settings and that kind of thing, when we're faced with our own grief and our own um, losses and that sort of thing, that vicarious trauma of the other people that we've been helping just kind of comes up, and it just creates kind of this complicated grief, if you will. for people. And I think being able to acknowledge that is something that's important for people.
Yeah, I mean, and thank you for mentioning vicarious trauma. It just means that we get affected by listening to the trauma stories of others, and it's not a sign of weakness or a reason for judgment. Just means that we are genuine, that we are compassionate, that we care about others, and this is the price that we pay for being a caregiver. The wounds that we carry with us, especially the soul ache, that will eventually lead to burnout. That's why it's very, very important, as you said, that we really pause and reflect and spend some time to nurse our own wounds while nursing the wounds of others.
Right, right. And we have to give people space to heal. I'm reminded when I heard the title of your book, The Wounded Healer, one of the things that I was reminded of is a metaphor that I use a lot with people in my own work as a therapist, and that is of a physical wound. In that when we receive a physical wound, we can do things on the surface to help facilitate healing, but ultimately the healing of or the knitting together of a wound has to come from within. But we've got to allow people the room to do that, and in many ways kind of permission to heal from within, but at the same time being aware of not poking at the wounds, so to speak, and reopening the wounds. And so yeah.
Absolutely. And what's very unfortunate when it comes to emotional wounds, at least when you are wounded physically, people will actually point that out and they will rush you to the emergency room and make sure that you are taken care of. But when somebody is emotionally bleeding in front of us, we will actually neglect their wound or tell them that they should not talk about it, and it's a reason for stigma and for silence. And that's something that we need to really change.
Yeah. Well, one thing that I've mentioned before on this podcast, and I really feel like maybe one of the silver linings of the COVID pandemic is that it gave people the what they needed and to be able to speak up about mental illness and emotional trauma, because we were all affected by it in different ways, at different levels. And so I think, at least I'm hopeful that we're able to have more open conversations around mental health and emotional health without the stigma as much.
Yeah, and I hope the systems will catch up too, because individually we can have these conversations, but if you work in a system that will discourage you from talking about this or punishes you for it, then many people will remain silent, and this is a cycle that we need to break together.
Right. Yeah. So Omar, I want to be respectful of your time, and I'm so glad we had this conversation. What are maybe some closing thoughts that you have around this topic of the wounded healer?
I think they have to do with the 4 chapters. The first one, yes, I mean, our relationship with our clients can lead us to listen to trauma story that can cause burnout and soul ache. But please, when we listen to the trauma of others, we need to also listen for resilience, for beauty, and make sure that we give them meaning of what happened to them. And together we walk towards closure and healing. When it comes to the relationship with our loved ones, I don't want any of my coworkers to lose the American dream chasing it. Yes, we work long hours to try to take care of the materialistic needs of our children, our spouses, but we should not neglect their emotional needs. When it comes to systems, there are systems that are toxic, that are not healthy for your well-being. If you can rehabilitate a system, that's wonderful. Otherwise, maybe you need to just find a better environment for you. Sometimes leaving is better than half staying. And eventually, chapter 4 talks about really paying attention to our soul ache, not ignoring the deep voice that we hear. That's the voice of our soul aching. So expressing emotions, taking care of our deep wounds is something that we really owe it, not only to our clients, but also to our loved ones.
Yes, yes, I love that. Yes. So, Omar, tell folks how, if they want to get in touch with you and also get access to the book, what's the best way for them to do that?
Thank you, Gordon. So the book is available everywhere on Amazon and all other bookstores. My website is dromarreda.com. So that's DROMARREDA.com.
Well, Omar, I'm so glad you joined me on the podcast. Well, again, a big thanks for Dr. Reda for joining me on the podcast. And as you can tell, he is such a gentle soul, and I really appreciate his work and his advocacy around these issues of our, not only, our patients' mental health, but also our mental health as caregivers. It's interesting how it tends to go for us in the mental health fields that we know all the stuff, but sometimes we neglect our own mental health and our own needs. And again, like I said at the beginning, this is a theme that I've run into this particular month around these different episodes. And I think it was interesting that this came up. So anyway, thanks again to Dr. Reda for joining me. Be sure and check out his things and his book, The Wounded Healer, and you can find links so you can access those easily in our show notes and show summary. So be sure and check those things out. And also, I'd love for you to check out the Practice Launch Club and find out more about that, particularly if you are wanting support in those beginning stages of starting a practice or getting it to scale, that sort of thing. I think that the Practice Launch Club is really going to be beneficial for you. It's the whole reason that I started it, is to give people support and a sense of community around building their practices. So check it out at practiceoftherapy.com/launch club. And also, a big thanks to our sponsor of the podcast, TherapyNotes. They are the leading electronic health record system for mental health providers. They're who I use in my practice and absolutely couldn't do without them. So be sure to check them out by going to practiceoftherapy.com/therapynotes. And also, I'd love for you to check out the other great podcasters that are part of the PsychCraft Network. This being one, but there are also at least 6 other podcasts that are part of this network. And you can find out more about them by going to psychcraftnetwork.com and learn more about that and the other great podcasters out there. So take care, folks. Have a good rest of your week and weekend, and hope you're having or have had a good Thanksgiving. Take care. You've been listening to the Practice of Therapy podcast with Gordon Brewer, part of the PsychCraft network of podcasts. You can find out more about the other great podcasts in the network by visiting psychcraftnetwork.com. And if you haven't done so already, please visit us at practiceoftherapy.com and get your free private practice startup guide, along with a lot of other great resources and webinars and free things just by visiting. Also, be sure to follow us wherever you might be listening to your podcasts. This podcast is intended to be educational in purpose and is not intended to give legal, accounting, or counseling advice. If you need a professional, find the right person for that.